Hi, it's Colette. I haven't gone live in so long, I should say. And it's very impromptu, decided to go live, which I sometimes do to kind of discuss some things. I was thinking about a couple things. I was just talking to a new client and was kind of sharing with her a little bit about hormones. We were getting into gut health as well, but I wanted to come live and talk a little bit about hormones because I have had so many instances and seen so many things that I think it's just been something I've been wanting to talk about for a while, if that makes sense. For those of you who are kind of new to my page group, welcome. Hopefully, you've gotten great content in here and been able to learn some stuff while you're in here. But what I want to talk about is something I haven't talked about so deeply that I'm very, very passionate about. So before I got into really understanding in depth and the mastery of hormones, I experienced so many hormonal symptoms and it went on for years. It started very small into perimenopause where I'd have just low energy or hot flashes. And I just didn't think it was a big deal. And I even went so far as to go on, let me show you, um, hormone replacement therapy. And I had these vials. And even at that, I didn't quite understand it. Um, and even I wasn't even in the field at the time, but even um, being into more holistic, natural ways and being in that for 15 years, I still, meeting with the various doctors who put me on it, I still don't think I understood the reason why I shouldn't have stopped if I decided to take it. And hormone replacement therapy is not for everyone, but why it was so important and what it was really doing for my body because I wasn't as in depth in hormones as I am today, and I hadn't been trained on the Dutch Hormone Test. So I wanted to talk a little bit about why it's so important. Why does it matter if your hormones are in balance? What is the big deal? And what is the big deal if you don't have any symptoms and you do nothing? Okay. Now, I'm coming to a place of passion, of understanding, and a place of really caring because the more and more I see these reports coming back with these Dutch hormone tests, the more and more I'm like, wow, look at what happened. Look at what we prevented, what medical situation we prevented from happening. Okay. So let me back up a bit. Why do we care about the hormones? Why do we care about if they're not working? Well, first of all, if your hormones go unbalanced for too long, it takes just as long to get them rebalanced. Let me clarify that. So, let's say you start noticing things in your 40s and 45 and you're doing little things like maybe you're going to the drugstore and you're getting a pill that you see that takes away hot flashes. Are you really treating the problem or is it just the symptom? Is that really the best approach for you? Is that the right product? Are you actually doing lifestyle things that are going to change and help rebalance those hormones? Are you doing functional nutrition? Are you creating the right habits? Probably not. And that's where I was. As those hormones continue to be unbalanced, it takes longer to get them rebalanced. Once you get past a certain age, what worked earlier on, you don't have access to that anymore. Um, so there's different approaches. So does that mean that you'll have to stay with them unbalanced? No, but the approaches change. So the earlier you deal with it, the better off you are. Does that mean that there's nothing and no solutions? No. I can work with anyone no matter what their age is. And one of the things that's the most critical to understand is the fact that the longer they stay unbalanced, the longer it takes to rebalance them. So many people come to me with symptoms and they want a quick fix. It doesn't work that way with hormones. It's usually about a 3-month turnaround. And does that mean you're going to stay feeling horrible forever? No. There'll be small incremental changes. But why is it so important to understand what them being imbalanced means? Why couldn't you just go to the drugstore or get these advertised patches that take away your symptoms? Here's why. So the other day I was working with a client and I gave her the code that I give to clients and to go and get her Dutch hormone test. And I don't make any money off this. She came back and I read the test. And what we discovered is a couple things. First of all, there's various estrogens in the body. There's something called 2-OH, 4-OH, 16-OH. Some of them are good and protective, and they have anti-cancer properties. Some of them have good and bad, and some of them are not good. You want the ones that are good to be at a certain percentage, so pretty high. The ones that are bad, obviously you want those to be lower, and the ones that have good and bad, they also have to be at a certain percentage. Now her one that had both good and bad in it was 4 times the level it should have been. What did that say to us? That said to us that we had to take some measures and create a plan for her to rebalance those, okay, to restore those levels. The other thing we were able to see from the test was her methylation. And in layman's terms, what that means is how does your body get rid of the estrogen? The good, the bad, the good and bad together. Can your body get rid of it? So if you have too much in your body, how can it get rid of it? And that's an important process because if there's a problem at that end, there's a slew of other things it can do to the body. So your body has to be able to take in that estrogen and get rid of it. And I'm just talking about estrogen right now, okay? So it has to take a hold of what it needs and then get rid of the excess. So if there's a problem with that methylation, that's something else that has to be addressed. The couple things we knew was she was saying, I'm estrogen dominant. Well, there was a reason why she was estrogen dominant, and it had to do with how things went up the up cycle of it and how it was causing the problem once things went up and it turned into a certain form of estrogen. Okay, I'm using a lot of vagaries here. So we had to address that with nutrition, functional nutrition, things that I wanted her to get curious about. We had to address that with various lifestyle changes and habits that she needed to get curious about. There's other things on that test that's also important. Now, I did not have any, thankfully, a creatine, which is the liver function, shows up on that test. I know many of my colleagues have had to send people to their doctors to say, hey, do you realize that there's something going on with your liver? To preventing a problem that could be a future problem, okay? Also, let me scroll back to the estrogen. In this particular situation with the estrogen was there to protect from cancer and to protect from tumor growth, okay? The other thing is with hormones, we see many instances where people are in great shape physically. They have a fall and they break their hip, they shatter their hip. Why is this occurring? This has to do with your hormones. It's not merely about just taking a calcium pill or drinking a lot of dairy. This has to do with your hormone levels. So when we just throw things without understanding, we just go to CVS, we just go get a patch to shut down our symptoms, that is not something you want to do. Those symptoms are not the root cause. And as a functional medicine health coach, I deal with root cause because we want to know what is the root cause of why you're feeling the way you're feeling. And those symptoms are there for a purpose to tell you that something's wrong, something's off balance. When you shut those symptoms down, it no longer tells you that there's a problem. So you continue to compile and the problem gets worse. Your bad estrogen keeps going up, which puts you at a higher risk for all kinds of things going on in the body, for potential tumors, um, uh, bone bone mass, bone issues, bone breaks, where the that's too, you know, too low, too high, and it's the ratio of how that 2OH, 4OH, 16OH estrogens basically play in the sandbox, how they play together, okay? And then, of course, there's your other hormones. The other thing that's so cool is the fact that, let's say you have very few symptoms. Like I had a recent client where you maybe don't have many hot flashes, not really waking you up, you're sleeping okay, and maybe your energy is low, okay, but it's not too bad. And you think, well, what's the point? Why am I doing anything? The point is that your body is still sending you a message that things are off balance. Just because you're aging does not mean you should have low energy. Just because you're getting older does not mean that you shouldn't be sleeping well. Just because you're getting older doesn't mean you should have tons of aches and pains. That also can be the hormones being unbalanced. Those are symptoms of a bigger problem. And maybe the problem's not that big, but there are so many different ways that we can deal with cortisol, your stress, why you're gaining weight around the middle. And if you're ignoring that, that also can be impacting your sleep at night. And ignoring it doesn't deal with the problems. And when cortisol gets too high and you're not addressing it, it also affects your adrenal, which will affect your energy. And then it has a downward cycle. So ignoring or just reaching for a second cup of coffee or third cup, or um, just taking something through the drugstore just to treat a symptom is really not allowing you to look at the root cause and say, what do I need to do to address this from a functional nutrition level? What kinds of foods will help me? How do I address this from a lifestyle perspective? What things do I need to improve upon on my lifestyle? What things do I need to change? What old habits do I maybe need to replace with good habits now that I'm starting to age? And even in your 40s, there's plenty of time to do that. And what can I do moving forward? What needs to change? What can be prevented? If the headaches are coming, why are those headaches there? What is that telling you? Okay. So even when those symptoms are very, very minimal, you still need to reach out and say what's going on. The Dutch Hormone Test is the gold standard because it does look at the urine levels. And the Dutch Hormone Test does allow you to look at where your levels are so that you can make a change, so you can look at the root cause. Can you do this with blood? Not at the level you can do it with urine. And the blood one is great for later once you've done that Dutch test. Can we do things and look at it and change things from a functional nutrition, functional lifestyle perspective and with habits? Absolutely. But knowledge is power. And I feel that knowing what I know now, if you're having any symptoms, especially if you're in your 40s, now's the time to start addressing those before those symptoms get so large that you feel bad for too long. And that's where I was, where I felt bad for too long and I let it go because I was like, and it just compounds where that's your new normal, where it's just your story. I'm tired. That's just the way I am. I work too much. I've urine leakage. When I can't run now because I've urine leakage. Again, that's hormonal. That can be hormonal imbalances. So I challenge you to write down what's going on in your body and think about what you want to do about it. Don't wait to do something. Reach out to me and let's take a look at where things are in your body and let's address them. Okay? If you're wanting to do hormone replacement and we look at the levels, then there's plenty of functional people that I can send you to and give you some ideas, or you can use someone you know. The idea is for someone to really understand it. Also, if you are doing hormone replacement therapy and you are not addressing your functional nutrition and your lifestyle and your habits, it's a big mistake. You have to take a hold of this from 3 different levels, from looking at how you're going to replace those levels, how you're going to address it from nutritionally and lifestyle wise with your habits. So those all matter because you can't just go take any pill or just do bioidentical hormone replacement without the education and knowledge to know what to do if things get off balance with stress. It is, and in perimenopause, there really is no balance. It's going to go up and down like a cycle. I used to think there was, and I talked about balance. You've heard me say that. There really isn't balance. And but what we do want to do is figure out what's going on so that we can address those things. We can make sure your anti-cancer estrogen levels remain high. We can make sure that we address those through habits, through lifestyle. We can make sure that those bad estrogens stay low so that, again, it doesn't cause other problems in your body. The other thing I want to address is if you're not sleeping, this could be cortisol, stress, and it could be blood sugar, which also goes hand in hand with hormones. And it could also be just, one aspect of the hormones being unbalanced. The other thing I want to talk about is if you have reversed your sleep-wake cycle, it's called your circadian rhythm, where you're super tired in the morning and you're wide awake at night. That takes a while to reverse, but that shows up on that Dutch hormone test too. And a lot of times how you're feeling shows up. And then you have that aha moment where you say, now I know why I was feeling so bad. Now I know what to do about it. So if this is you, and even if you're having a small amount of symptoms, reach out to me. Let's create a hormone balancing strategy, a plan to figure out how we address this from all perspectives. Look at where things are and get you to get those start balancing so things don't get worse, so you don't start feeling worse. You can have that energy back. You don't have to be in pain due to hormones all the time. You don't have to have sleepless nights. You don't have to have constant headaches. You can feel better. So reach out if I can help you so that we can create that plan. Drop me a message below. We can do a 15-minute discovery call where I kind of explain all the different aspects of how I work with people, the 8-week e-learning course that I've developed that complements everything and teaches you what you need to know for life so that your next 40 to 50 years are going to be phenomenal and you're going to feel great and you're not going to have to use excuses to say, well, I'm not able to do this anymore. I was there and I decided I didn't want to be there anymore. Have a good rest of the day.